Hi, good afternoon to everyone, or morning, depending on where you are in the world. This is Frank McNally from Public Spend Forum with our partners, Censeo Consulting Group as well. We're going to be talking about in this webinar a report that the Censeo Group has done on federal government spending, specifically on the COVID-19 response. So some really interesting data from Censeo Consulting Group that they've been able to source in part using some of the tools at Public Spend Forum like GovShop, which I'm going to talk about in a few minutes. So we appreciate you all being with us today. I want to introduce our speakers. I'm Frank McNally. I'm going to be moderating this today. I'm the Director of Learning and Content at Public Spend Forum. Also joined by our managing partner, Ben McMartin. Ben, you want to say a few words?
Just glad to be here, and I am a self-professed data geek. Although all of my training and education has been in arts, so I can't wait to geek out on some data with our friends from Censeo.
Great. Not sure if you need the data modifier there or not, Ben, but we're glad to have you on. Vinay, our managing partner at Censeo Consulting Group. Vinay, thanks for joining us today.
Thank you, Frank, and thank you to everyone who's taken time out of their calendars to join us today. Excited to be talking and sharing some of our findings on COVID spend patterns. And we'll get into this shortly. There is a lot of data that we will be sharing. And let me turn it over to Clara.
Thanks, Vinay. Also really excited to be here today. I've been spending a lot of time digging into the FPDS data, so I'm looking forward to discussing some of the insights and analysis with you all.
We're looking forward to happy hour if you've been digging through FPDS data. We appreciate you doing that. I'm definitely looking forward. There's some really neat visualizations in this report from what I've seen. So I want to get through a few things real quick before I turn it over to the team. I did mention GovShop when we were kicking this off. So GovShop is our tool for government market research. We're connecting buyers and suppliers in the public sector through GovShop, which is a tool that's free to use. It's browser-based, so you don't have to download any software. Anybody can use govshop.com today to start searching for opportunities, for suppliers, for government matches, anything that that you are doing in government market research or in government procurement. GovShop's going to be a central destination for you. And it was not an opportunity that we were really seeking, but the pandemic has presented us with an opportunity to be a part of the response and help out with the curation and procurement of COVID-19 supplies, personal protective equipment, ventilators, masks, and the like. We've been running drills for several agencies in the government since this really started back in March to identify suppliers that have PPE or COVID-related supplies. And so we started to build some specific resources on GovShop, and I wanted to show you a few of those before we dig into the report. So Yanisa, I believe, has sent out a link to this landing page. This is our coronavirus landing page. So you can visit this page and see all the resources that we do have. And one thing I want to point out is some of these commodity codes. So we know it's a pretty diverse area, and we'll see that in some of the FPDS reporting analysis that Clara will share. But we sort of organized it by commodity groupings. So vaccines, therapeutics, ventilators, and PPE. So if you're looking for something specific, hopefully this will help you find and narrow down to those suppliers that have precisely what you're looking for. Some of the insights that you'll see on this landing page are what we're going to be talking about today, the analytics, the implications. These are all great resources that you can read. We have opportunities, an entire page of opportunities, whether that's agencies in the federal government or at the state level looking for supplies. So if you're a vendor and you are selling COVID-related supplies, you need to make sure you have your GovShop profile, not only so that you can connect with these opportunities, but so that you can be found by buyers that are doing market research and looking for the products and services that you have on offer. If you're a government contracting professional or program professional, you are able to browse and filter all of these suppliers. I've read the report, and I do say it's I guess I'm not I shouldn't be surprised, but I did find it noteworthy that a lot of the spending has been on small business. So with the filters that we provide in GovShop, you're able to filter by small business status. If I'm looking for 8A companies or hub zone companies, I can filter down to just those companies that are offering that. So test kits. There is one hub zone company that's offering, test kits and the like. So a lot of neat filters designed specifically for government market research. The ability to build lists, to export profiles, all of these things are available in GovShop and explained in our YouTube tutorial playlist, which we'll put out a link to that in the post-event briefing. Last page I want to show, and Ben can jump in here before we get on to the report, is that we are updating the data in real time. So Ben, you've been involved in the curation here, and this is just a great resource of supply chain and supplier data, who's got what and where. Anything to say on this?
Yeah, Frank, I just really want to thank our government partners who have really supported us and been the impetus for building out what is, the single point for identifying what the supply chain is for, masks, ventilators, PPE, therapeutics. And so I gotta definitely give a shout out to the Department of the Army, Department of the Air Force, the Joint Task Force on the COVID response, and then our state and local partners as well, New York, Virginia, and Maryland. They really were the driver in what areas we concentrated on first and how it was built out. And then working with partners like Strike Labs, who on the demand side, actually working with those hospitals directly on what they need now so that we can match supply with demand. So GovShop and Public Spend Forum had a role to play. But at the end of the day, this is a big effort that went across federal government, state government, demand side, supply side, and it's ongoing. We're not out of it yet, and we still continue to identify where the issues are in supply chain and where you can get inventory.
Yeah, well said. And you're right. There's been a lot of activity on all sides, and I'll just say, I think I can speak for everybody on our team when I say it's been a pleasure and a privilege to be, a part of this. Pleasure is probably not the right word, but a privilege to be part of supporting this response. Okay. Well, that's enough of that for now. I would like to hear from Vinay and Clara, so I will turn it over to you all, and we'll look forward to hearing more from your reporting.
Thank you, Frank. So before we jump into the report, I did want to take a minute to kind of talk about why we are doing this and what the sort of big impetus behind it was. Censeo Consulting Group, is a small boutique management consulting firm. We work with pretty much every federal government agency, both civilian as well as defense. And across the last few months, no surprises here, but one of the questions that we have been hearing from various different agencies and leaders within those agencies has been around, how are other agencies responding? Right? What kinds of things are they purchasing to equip them deliver their mission during these times? Where are they looking for to get these things that they are buying? Right? Which vendors, which suppliers? Are there particular areas where demand seems to be outstripping supply? Are there choke points, bottlenecks that we need to be aware of and prepare for as we think through our own agency's response? So there's a lot of questions, and really the idea behind this report was to conduct some analysis that agency leaders and policymakers could use to inform their own organization's response to the COVID-19 crisis. So it's really meant to start the conversation going, give folks an opportunity to see what other leaders in the government are doing, and potentially open up opportunities and ideas for collaboration amongst agencies. But then on the flip side, I think, I know we do have quite a few folks from the private sector here on the call today as well. I think the thinking here is hopefully industry participants will get a chance to kind of understand where the government's needs are during these difficult times and hopefully direct their response efforts towards those areas. So that was the broad impetus behind the report. If we go to the next slide, which has the executive summary of the findings, before I get into the executive summary, I should point out that this report and all of the analysis within it is based off of publicly reported information that is within FPDS. Earlier, back in early March, OMB issued guidance, noting that agencies should report their spend on COVID-19 related matters within 2 weeks of the spend. So there is a lag in the report. So this covers 6 weeks from March 13th, which is when the COVID flag was introduced in FPDS, through April 9. We will keep monitoring and refreshing this report probably on a weekly or fortnightly cadence as we see new trends and as the data set grows. But there is definitely a 2-week lag. Now, that being said, there is still plenty of directional insight that I think agency leaders can glean from the data that has been assembled thus far, again, pointing to opportunities to collaborate with their peers and other agencies, and also get insight into market patterns. We will walk through the data in just a bit, but at a high level, there are about 3 or 4 key takeaways here. The first is, I think, if you just think about the way we are reporting information here in FPDS, there is potentially an opportunity to improve the way that can be done going forward. So in other words, can we cut down the lag, try to make it more real time? Also, right now, the way the flag is set up is that when an agency, let us say, issues a contract of which a portion of that contract is on COVID-related matters, but the rest of it is on other things, the flag, unfortunately, is a binary flag. So you either count the entire contract as a COVID-19 contract or you don't. So that introduces some noise into the data. So in general, I think data management, data governance, and reporting is an opportunity area as the crisis and the response to the crisis evolves. In terms of where the spend has been concentrated, obviously no surprises here that in the first few weeks of the response, the focus has been on medical supplies. That being said, we are seeing some interesting trends in other categories as well. So especially as the crisis hopefully recedes in the near term, we expect to see that spend shifting to other more infrastructure related areas, construction, professional services, and so forth. The market analysis, meaning, which vendors are currently helping the government with their response. Again, no surprises. There's a few large vendors who are well positioned to gear up to meet the demand. That being said, there are more and more opportunities that we are seeing for small businesses to participate in the response as well. So that's the high level findings. Clara, anything you would like to add here?
No, Vinay, I think that really covered our high level findings well, and I'm excited to dig a little bit more deeper into the data to see what insights we have there.
Wonderful. And before we jump in, Ben, any thoughts from your end? You have been on the other side as well, right, as a senior official within the government. So what are some of the things that you would encourage our attendees today to look out for as we walk through the material?
Yeah, my opinions on this, coming from the other side of it for the majority of my career, are that don't get lost in bad data. We all know that data lags, and we know that there's going to be instances of folks who don't know how to tag things or forget to tag them, or all the all the issues that come with data, which are all people based, right? But there are definite trends and that can be taken from the data as is, understanding that error rate, whether it's COVID or anything else, is always a constant. So I think the trends are legitimate, and we've seen the trends over the 6 weeks. they have matched up with the situation on the ground. So I think there's definitely some opportunities to analyze the data, take some of these data cuts and see where the trends are leading, and use that as actionable data. I always hate when people come out and they say, well, yeah, this is some good data, but people forgot to put it in, or they made mistakes, or it's over inclusive in contracts. Understood. It's always that way. Understand that it is, identify it, realize that there's errors involved in it, but then take it for what you can get out of it. So I think people can really use this data, and I'm just excited to walk through it.
Fantastic. So let's dig in then and go to the next slide. So this is the high-level picture of how the spend has been deployed over the last six weeks. And so again, no surprises, right? The initial spend has been dominated by medical and medical equipment and supplies. That being said, as you can see in the bar, the third bar from the left, there is definitely a trend in terms of other categories that are rising, in terms of their proportion of spend, and we'll get into that in just a little bit. But overall, this kind of shows you the landscape of things that the government has been purchasing in response to the crisis, right? So this is about $7 billion of agency spend that has been analyzed here. Clara, any particular nuggets that you want to call out on the slide?
Yeah, I think there are a few interesting takeaways from this slide. Thanks, Vinay. So just having dug into the data a little bit more today, I was taking a look at the most recent data pull, and it just goes to show some of the issues that Vinay was already talking about with respect to the data quality and the lag that's present in the data. So you'll see that the data on this slide was last updated on April 23rd. So that was about 2 weeks ago. But then looking at the data as of 2 days ago on May 5th, the medical and surgical instrument category has surged from about $2.8 billion to what's now more than $4 billion. So that week 6 and now week 7, week 8 categories are starting to show an increase in spending that's not reflected for about 2 weeks out. So that just gives some concrete evidence to the fact that we're not really able to get kind of those immediate insights out of the data due to the lag that is present in reporting. So there's a definite opportunity within the data reporting itself to improve the ability to get real-time insights out of it. That being said, though, as been said earlier, there's still the potential to construe a lot from this data set. When you look at the first report that we did that covered the period from March 13th to April 9th, it did capture 6 of what today are the top 8 spend categories. So there is a high degree of reliability within the actual categories of the data set that really shows the trends that are driving federal spending to date. So it is important to look at the data with the lens of the lag in reporting, and then also the fact that the data is capturing some categories that might be over exaggerated, such as the spend on IT and telecom. However, within that, there are certainly some real actionable insights we can get from even looking at the data at this kind of high level. I think one more thing to call out on this slide in particular is that the other category accounts for more than half, really, of what was spent on the largest spend category, medical and surgical instruments. So we'll talk through a little bit later, but there's definitely some more insights buried within that other category.
That's right. That's right. And so with that, why don't we go to the next slide? And this, so nice segue into the other category, but this kind of shows you what that other bucket actually contains, because in our, again, as the crisis response evolves, we fully expect to see more and more of the categories that are currently sort of lumped together in this other to kind of break out as the nature of the response itself changes. And so what you see on this slide are, the top, the top components within the other spend category, and the little arrows that you see to the left of each of those rows tells you sort of what has been happening with respect to that subcategory, right? Has it been rising up in the rankings or going down, right? And so these are the ones that are rising up in the ranking. The other, and this is sort of visually very obvious, right? Because what we are showing you here in the two columns is how much was spent on one of these categories in the first week that the data was reported back in the middle of March versus week 6, which is the April 17th to 23rd, right? And so, if you think about the professional services other category, what this is telling us is that in the first week there was $47,000 spent on it, but now in week 6 we are seeing $53 million being spent on it. So clearly these are categories that were perhaps not as relevant in the early stages of the response, which was very much focused on saving lives and therefore medical equipment and supplies. But now, as we are thinking about as the immediate crisis sort of goes behind us, and we start thinking about recovery, economic recovery and longer term enablers, we expect to see some of these other categories start rising up. Also, I think for folks from the government who are on the call today, this hopefully gives you a sort of an early warning signal, if you will, on where where your agency might find where your agency's needs might be going towards. And I'm sure, of course, you'll be hearing from your program folks and your lines of business, but this provides another lens as well. Again, let me turn it to Clara to give us any further details, and then would love to get Ben's view as well on this data.
Thanks, Vinay. Yeah, the one thing that I'll add here is that from week to week, as we keep looking at this data and keep trying to see what additional insights we can get out of the data set, one thing that we've been noticing is that the categories that make up this other category have been changing dramatically, and the categories that make up this kind of top 15 group that we're looking at here are also changing from week to week. So I think that just goes to highlight even more the fact that the demands of the crisis response are rapidly evolving. And as we're thinking about the data that we showed on that first slide, just covering the largest spend categories, I think we're starting to see some trends within this category that will likely not quite surpass that first medical and equipment category, but there are some other, for example, professional services and support categories that will likely grow even more important as the government starts to disperse funds in response to the CARES Act. And I'll turn it back to Ben to see if there's anything else he'd like to add.
Sure. The pieces that really stick out to me on here is when you look at R&D, that trend line is exactly how it should be, especially when you throw that parenthetical of basic research on the end of it. I would expect 0 in weeks 1, 2, maybe even 3. And that's really how the spend looked if we were to break these categories down one by one, because the immediate need was for supplies and services, and now you're starting to see that research. So if you're a research company in this area, you didn't miss out on anything. You weren't, your area, the services that you provide in R&D were never going to be in the first 3 weeks of spend. So right now is the time when you're seeing those solicitations for research related to this. And obviously Frank showed us at the beginning, that those are captured on GovShop in addition to, federal and state sites. One thing overall on this chart that folks need to keep in mind is that these are obligated dollars over a very short period of time. So you're talking about billions of dollars obligated within 6 weeks to meet an emergency. So, okay, Ben, who cares? What does that mean? Well, that means when you look at that $866 million week one on medical, and I can tell you, if we broke that down PSC code, that's really, and we're going to later, that's really, those health and medical items, supplies and services. Those were obligations in week one. If you're reading the news like I am every day, you're starting to hear the stories of the companies that got those initial contracts and can't deliver, right? And now's the time for delivery. We're about 6 weeks out. Folks will probably be strained to continue to deliver on those large contracts from the beginning. So if you are in those product service codes for the federal government, and this is federal government spend, you're definitely not out of this game yet. I can tell you that. The folks that got those contracts right off the bat still have to deliver. These are obligated dollars, not disbursed dollars. So I don't expect that line to go away. I expect, dollars to reemerge in that medical supply line. And then the final thing I'll say on this chart is telehealth. If you are a company mapping out where the opportunities are in the future, I can tell you telehealth is definitely going to be where I expect to see dollars go. And that'll be at multiple levels. That'll be R&D dollars for agencies that are just experience how to work with telehealth, but you also see that in the professional services as well. And so whether that's going to fall under professional services or IT and telecom depends how it's scoped. But those are areas where I would look for the trends to go, which is a resurgence of supplies where delivery didn't happen, R&D, and then the telehealth industry.
Great, thank you, Ben. So with that, let's move on to the next analysis. And so here, what we've done is rather than looking at the categories that dollars are being spent against, this shows you the breakdown by agencies, right? So for the top 10 or so agencies, and specifically how much are they spending, as well as what are the top 3 things that they are spending on. Again, I think if you look at the big picture here, it's clear that, the initial story here has been dominated by Health and Human Services, right? Again, no surprises there, or Department of Veterans Affairs, right? There is one, this is again a small quirk of the data, but the DoD spend is within FPDS is not necessarily fully captured, simply because there is a 90-day period before the DoD data can be reported out in FPDS. So definitely we expect the DoD line to certainly grow as we get to that point. I think a couple of other trends here, you can see some, and we have been tracking this data on a weekly basis, right? So for example, the Small Business Administration was not even on this chart, a few weeks back, but now it is, right? And so again, as the CARES Act gets implemented by different agencies, we do expect, some of these agencies which are currently towards the bottom of the list to start moving up as well. I think the other way, especially for our federal audience on the call today, is you can kind of get a sense for which agencies have been on the front lines of the response, what they have been spending on. So, hopefully it will give you a sense for which peers to reach out to should you have questions about sourcing, any of these categories. So let me pause there and turn it over to Clara to share any further more detailed insights.
Thanks, Vinay. Yeah, I think just another point to really clearly show what Vinay's describing there is in the first few weeks, we've seen that Health and Human Services has really just been driving the spending, particularly from medical, dental, and hospital equipment category. If you look at the data updated as of this week, the chart that you see here was updated as of April 23rd. The Department of Homeland Security has just surged in its spending relative to the other agencies, still behind that of Health and Human Services, but over $1 billion total by Health and Human Services. I'm sorry, by Department of Homeland Security as of this week. And it's really spending in the same categories as Health and Human Services, particularly in that medical equipment category. So there's a real opportunity for agencies to shadow each other and learn from each other in those kinds of ways. They start to see similar patterns emerge in their spending and the needs moving forward.
Ben, anything from your end in terms of how you would recommend folks, especially I think both industry as well as government, to use this data to find opportunities to perhaps learn from each other or peers to reach out to?
Yeah, I think, one interesting part on the data on this one is in week one, Veterans Affairs, Department of State, and Coast Guard were the top three spenders in the federal agency. If you just take week one. Now, does week one mean that those were the only three agencies that realized there was a COVID-19 tag to add to their awards? Perhaps. But we also know that in that first week, Veterans Affairs put multiple long-term contracts in place for exactly what you see up there: surgical and medical instrument manufacturing, clothing, and laboratory equipment and supplies. Look at where State Department is in terms of total spend. So if I'm looking at where I can plug into this from a vendor side, State Department looks like it did most of its spending in those categories: medical, dental, hospital equipment, and supplies in that first week, because they've really dropped off since. Health and Human Services wasn't even in the top three in week one. They have surged majorly along the line of this. As far as it comes to federal agencies looking across at each other, in terms of contract coverage, if you are a agency coming to the game now and your agency needs to do buying in any of these areas, hey, the Veterans Affairs organization has had contracts in place for 6 weeks. So, I mean, that's really an opportunity to reach out to the VA or reach out to Health and Human Services and say, hey, before we go and try to place orders against an already extended supply chain, what orders have you already locked down on? What supplies do you need, and how can we team on it? And so, I expect there's going to be a lot of duplicative contracts. These contracts are going out as giant task orders, billion-dollar task orders, with a couple $100,000 as the minimum guaranteed amount. No reason to have, tons of these multi-billion-dollar task orders out there. We really, agencies can really benefit from reaching out to each other and discussing, hey, who's already locked down contracts in these areas? How can we get ordering authority off of your existing contracts? How can we diversify the spend so that we're not all, competing with each other, which is what we heard on the state side, right? Between the states and the federal government in the first couple of weeks was everyone was out there buying. It looked like there was this giant balloon demand, and there was a giant demand, but probably not the size of what the contracts represent now. And of course that drove prices as well. So, easier said than done. I worked for the Department of Defense for 11 years. It was hard enough just to get the agency across the parking lot to talk to me. But if you're looking for existing contracts, the departments that already have them in place are the week one leaders: Coast Guard, State Department, Veterans Affairs.
Thank you, Ben. Thank you, Ben. Let us move on to the next analysis now. So here, so in the previous slide, we saw, which agencies were leading the charge in terms of spend. here, what we are doing is looking at which vendors, so looking at the market side of the equation, which vendors are actually supplying the goods and services that the government needs right now. And the big finding here, and you can see this in, so there's actually two things here. I mean, clearly in some categories where, there's been so much of demand, such as, medical equipment right there on the first line, there's a lot of industry players have, come to help the government with their response, right? So 360 vendors there. There are others, other categories, such as if you look at the, the architect and engineering construction, hospital buildings in particular, right? There are fewer players there. And again, no surprises, right? These are highly capital intensive businesses, whereas, small businesses, for instance, can provide medical supplies and so forth. So that shows you sort of the coverage, if you will, of the vendor landscape in terms of meeting these needs. And then the analysis on the right-hand side of the slide shows you, how much of the spend is really going to the top 3 vendors in each category, right? So what this tells us then, if you look at the first row, is that about a little bit over half of that $2.8 billion on medical equipment and supplies has gone to 3 companies, right? The 3 that you see here. It's even more in some of these other categories, right? Like drugs and biologicals, or financial management support, and so forth. So clearly there is a reliance right now, at least looking at 6 weeks of data here, on a few big industry players to meet the bulk of the government's needs. There's also certain categories where clearly there are more vendors than in others. So potentially it is an opportunity here for folks who might not have considered, or who don't really play in the government space, to potentially take an active role now in helping the government with the response, right? And Ben, I'm sure you can attest, right? PSF and GovShop, they track more than 1.5 million suppliers within the GovShop database, right? So I'm sure if we were to do a search on GovShop and we were to see, hey, how many vendors are there who can actually supply medical and surgical equipment and supplies, I'm sure it's going to be way more than 360, right? But right now, there's only 360 people, providing those goods and services to the government, potentially an opportunity for others to come and be a part of the response. And again, an opportunity for the government itself to diversify its own supply chain, so it is less reliant on a small set of vendors. I mean, if there is one lesson to take away from the crisis, is that folks within the government like to talk about efficiency and effectiveness, and how do we become more efficient at delivering our mission effectively. I think resiliency is, the new thing that everyone needs to be aware of, right? How do we have backup plans? How do we make sure that, if the supplier who's currently providing services to us has a crisis of their own, do we have a backup plan? Now, if 99% of your spend is being spent on on 3 vendors, that is a significant risk to your supply chain for those goods and services, right? So I think that is the other lesson that we can take away from here. Clara, anything to add in terms of the data?
Yeah, I think that's a great point that you bring up, Vinay, just with regards to the potential for bottlenecks and the potential for over-reliance on a particular subset of vendors. If we're looking at the 4th column on this page here, the top 3 vendor column, an interesting takeaway from my perspective is that the bolded text here refers to vendors that are new from the previous week. So if you look at all of the rows here, the only row with new vendors is that new category, financial support. So we're not just talking about the same 3 vendors being responsible for upwards of 80% of spend, but it's the same 3 vendors from week to week who are responsible for that spend. So that just, I think, to me, reiterates the need for enabling new vendors to really get into the game and to be able to support some of the more emerging needs here.
Ben, any comments from your end, especially given that GovShop clearly has a visibility into the vendor landscape within each of these categories?
Yeah, absolutely. I mean, in medical and surgical instruments, equipment, and supplies alone, we were able to identify over 1,100 suppliers right off the bat um, that were able to support in this area. So now, keep in mind, there's some factors in that data. One is these are 1,100 vendors that work in that area. They don't necessarily work or want to work with the federal government. So working with the federal government is its own beast, right? But I want to temper this data a little bit because I agree for a couple aspects. One, row 3, if 99.79% of your spend goes to 3 companies and you only have 8 companies, that's an area where you need some diversification because obviously, your base is so low in what you can do in that area that, the government's probably held hostage there quite a bit. I know I'm held hostage on my student loans by Navient, who's number 3 on there. That's just a little tongue in cheek. Nothing wrong with the Navient people, although I do pay them monthly. But when you look at category 1 or row 1, yes, we would love to see that say 700 or 1,000. And if that row was, medical and surgical instrument supplies, equipment in a normal environment, a normal contracting environment, then it should say 1,100, 2,000, 3,000. The reality is, this data probably could be better, but in an emergency contracting environment, you got to go with who can get you supplies, who you trust, who you've done business with before. So in that vein, I'm not as surprised with seeing 360 on there. You cannot do emergency contracting with folks that you've never heard of, such as a company who identifies that they do blockchain and then tells you they're going to sell you, $36 million worth of N95 masks. And then lo and behold, you find out that they don't have them. You really do have to contract in an emergency session, at least for those first 4, 5, 6 weeks, which is what this data is, with the folks that you can readily get on contract, that know how to work with the federal government, and that you can trust to perform. I would love to see this exact chart, same product service codes last year this time, and see what the spend looks like just in general across that product service code. And my guess would be that there would be more vendors because you have less of an emergency contracting environment.
That's a great point, Ben. Again, we are going to keep tracking this data over time, so it'll be interesting to see how this evolves. Can we move to the next slide now? So this is continuing to just look at the vendor landscape, but here the lens that we brought to this analysis was, are there particular categories, products and services where demand seems to be outstripping supply, right? So essentially what the analysis in the middle of the slide here shows you is how, the spend in a given category has been going up across the last 3 weeks of the data set. So week of April 9th to week of April 16th to the week of April 23rd. And so if you look at medical and surgical equipment and supplies, essentially what this is telling us is that, looking from April 9th to the next 2 weeks, there was a 540% increase in the amount that was spent, right? Dollars obligated. Then we look at the vendors, and then we say how many vendors were there, 3 weeks ago versus how many vendors are there now, right? And so that 360 number that we saw on the previous slide, right? That was just for the current week, right? So, but 3 weeks back, there were not 360 suppliers in this row, right? So the number of suppliers has gone up by 60%. Basically, 60% increase in vendors, 5.4x increase in spend. So clearly the number of vendors is not sort of kept up, if you will, with the pace at which the spend has grown, right? And that is why you can see how the top 3 vendors still account for the bulk of the spend here week on week. And you see a similar sort of analysis done for the 2 other codes, the drugs and biologicals and hospital and surgical equipment. So I think the big takeaway for us here is, again, we are in the early stages of the crisis, right? We're again, 6 weeks into this. Like Ben just said, during emergency procurements, you do have to do business with folks you've done business with before, who know how to transact with the government and who can actually deliver the goods, right? And meaning you trust them. And so perhaps it's not surprising that the number of vendors has not kept pace with the total amount of dollars that are being obligated. However, as we monitor this data over time, we would expect, hopefully, to see an uptick in the number of vendors as well. Clara, any additional insights here?
Yeah, I think the only thing that I'll add to that, Vinay, is as the weeks keep moving on, we're going to keep evaluating other categories as well. Right now, we've just been looking at the 3 of the top product and service codes from the first 6 weeks, but we'll also keep monitoring other codes that might be higher risk for bottlenecks or potential supply breakdowns.
Great. Ben, any comments from your end before we move on to the final analysis?
Yeah, just one small comment. The drugs and biologicals line is fascinating because here you're increasing 30% of who the players are, and you're not really putting that many more dollars against it. And to me, that really shows, drugs and biologicals are going to lag. They're going to be on the end of this thing. They're going to be associated with those research and development dollars, which matches up with our trend from above. But here we really have the government spreading out its bets and saying we need to have multiple bets and figure out who's going to have the best chance of developing on this. And then that's where we'll invest later on. So I expect them to continue to spread out, make small bets. And then eventually we'll see it down selected to a solution as we move on. Whereas the other ones, once we've gotten past emergency procedures, and I believe we're there, I would hope to see that vendor number now begin to really bump up, and that spend's going to start coming down because there's only so much, supplies and services that you can buy.
That's right. And so with that, let's move on to the final analysis in the in this presentation. And here we looked at, the proportion of spend that is going to small businesses, because as everyone knows, clearly one of the things the government has always tried to do is to encourage small businesses, and there are goals, as everyone knows, for agencies in this regard, right? And so the left-hand chart, so for each of the categories that you see listed in the middle of the slide, the left-hand chart essentially shows us the total spend on that category to date in the first 6 weeks. And, here we are only taking that very first category from our first slide, the biggest one, right? Medical and surgical equipment and supplies. And we are essentially drilling deeper into it. So across the first 6 weeks, the government has spent $2.8 billion on this category, of which 11% went to small businesses. And then if you look at the right side, it gives you a sense for, again, out of those 360 vendors, how many players were big versus how many were small, right? And so as you can see, a little bit more than 2/3 of the people supplying these goods and services to the government are small business, and the other 1/3 are the big ones. So, I think the story here overall is, clearly the government is reaching out to the small business community, as you can see here on the right-hand side, right, in terms of the proportion of the vendor pool that is small business. However, in terms of where the dollars are actually going, the bulk of it is still going to the large companies, right? And again, I think the point here is, earlier on in the response, this is the point Ben made earlier, right? Earlier on, when you're doing emergency procurements, you go to the trusted folks, right? And so perhaps not surprising that, a lot of the initial spend was concentrated on large businesses. But I think the good news, though, is that in terms of, the number of vendors who are able to supply the government, the small business population is, fairly well represented. And hopefully, again, as the nature of the response shifts, there will be an opportunity for small businesses to see a greater share of the spend as well and supply more of the government's needs. So with that, let me turn it back to Clara for any concluding thoughts on this.
Yeah, I think the only thing I'll add here is to put it in the context of the analysis as a whole. Medical and surgical supplies are performing relatively well compared to other categories as far as the engagement of small businesses to date. As far as the total federal spend to date on the COVID response, the percentage has been far less than 2/3 engagement of small businesses. So just to drive home Vinay's point, I think there's the potential, and hopefully we'll see in the coming weeks, that the government's able to engage small business spenders across categories and provide opportunities and see what barriers to entry exist to ensure that small business capacity in particularly can be utilized as effectively as possible moving forward.
Ben, any concluding thoughts from your end before we hand it back to Frank?
Yeah, just my concluding thought on this slide is it's great that we got 68% of the total vendors of small business, but we all know, the buck stops at the buck, and that's on dollars spent. So I would not expect a different slide for an emergency situation such as we have. I expect the dollars to go to the known commodity large businesses with long-term contracts in the immediate aftermath or immediate piece of the pandemic. But restarting the economy depends on small businesses getting back to business and bringing back their employees. And so I would hope that over the next 6 weeks, we start to see the dollars rise on the small business side. GovShop's data for COVID, it tracks very well to what you're seeing on that total vendor side. We're a little higher with north of 70% of the businesses working in this area really are small business concerns. And so we'd like to see the dollars come back a little closer to that. So for any of our agency friends or our PTAC friends or any of our friends that are on the line trying to understand how they can get their companies in front of agencies, or they can identify small businesses that can perform in this area, GovShop has identified over 1,100 companies that work in this area. Like I said, north of 70% are small business concerns. And they have their profiles publicly available to you for free on GovShop. And hopefully Frank here will wrap it up and show you how to do that. Like Frank said, GovShop is free for government. It is free for government to use and do their market research. It is free for suppliers to build their profile on. And our friends from AFWorks and Army have been leveraging GovShop to do market research during this pandemic to find companies that are available. So if you're a company or know of a company that is looking to get business in this area and get in front of the federal government, I would recommend that you go in and claim a free profile and let the federal government know that you're looking to work in this area.
Great. Thank you, Ben. So with that, let me turn it back to Frank to bring us home.
Great. Thanks, Vinay. Thanks, Clara and Ben, for all that information. It's great insight into what's been going on with the spending in the COVID crisis so far. And yeah, just a few points as we wrap up and with regard to GovShop. So if you are a small business or a vendor out there and you have items that might be relevant to this response, we do encourage you to go ahead and register your business. It is free to create a GovShop profile, and then you get to sort of extol all the benefits of your company in an open platform that will rank and index your supplier profile on Google, and so you can find additional active audience that you might not have been looking for otherwise. If you are looking to jump into the game right away and want to know, what opportunities are out there for selling COVID-related response items, go and check out the opportunities listing for COVID-19, and you can scroll through all of these amazing opportunities and see if there's anything that works for you, whether it's OTA, consortia, or just straight up procurement responses or solicitations. They're going to be here, and we encourage you to check that out. I think that's about it for me. I don't know if there are any questions, Yanisa.
Just had one question pop in. Doesn't SBA's DSBS do the same thing for government to do research with?
Yes. I mean, the DSBS does a lot of the same things. I've used DSBS and certainly a tool, and we mean to make things easier if we can. So hopefully GovShop has some advantages and features that, DSBS doesn't necessarily have, like for instance, being able to filter with a few different, expanded filters other than just sort of the small business status and, some of the commodity codes. But certainly DSBS is a resource. Like I said, I used it. I definitely appreciate GovShop for its simplicity and some of the other features that, you can do, like saving profiles, creating lists and the like. So, for sure. We also have state, local, and international contractors as well. So it's not just federal, SAM.gov entities in GovShop. So whoever asked that question, definitely reach out to me because I'd love to show you a little bit more about what you can do in GovShop. And get your take on what it would take for you to use GovShop instead of DSBS, because that would be of high interest to me. Well, if there's no other questions, we are recording this webinar. Will be posted on our webinar page. We'll also be sending out a link to download this report for you to pour over and get more insight out of. And as I said, as our panelists have mentioned, it will be updated frequently going forward. So Clara, Vinay, thank you so much for your diligence and your analysis and for taking the time to go through it today. And Ben, thanks for providing your insights from a government procurement standpoint. And for everyone in our audience, thanks for tuning in. This is a really important stuff, and we hope you are all staying well. And if there's anything that we can do for you, don't hesitate to reach out. And we hope to see you on our next webinar. Have a great afternoon. Thank you.